Within the sport of baseball, the usage of both lower extremities and upper extremities and the simultaneous use of both is extremely important. In baseball, injuries such as contact injuries are not as common as football, soccer, etc. However, bodily injuries focusing on ligaments and tendons and muscles are extremely common. Injuries such as these are extremely common in the sport of baseball because the sport demands a lot from your body and requires non-anatomically correct or safe movements. An overhead throw is a prime example of this. Compared to an anatomical position, a baseball throw is nearly 180 degrees away/different from an anatomically correct position. This puts immense amount of strain and risk of injury on your shoulder, elbow, and many other body muscles, ligaments, and tendons. The research that I have selected to talk about is the Efficacy of Prevention Program for Medial Elbow Injuries in Youth Baseball, investigated and performed at Yokohama Sports Medical Center in Japan. In youth baseball, injuries are very common. This could be from improper mechanics, growing pains, different maturity levels of muscle, ligaments, and tendons, and more. In the medical world, Little League elbow and Little League shoulder are two common medically diagnosed injuries. According to Boston College's hospital, Little League elbow is defined as a term used to describe pain in young throwing athletes' elbow, which may be due to injuries to the muscles, tendons, ligaments, and/or bones. Most of the time, Little League elbow is an overuse injury. When players, especially those between 9 and 14 years old, throw too much without rest, the elbow can become inflamed and sore. Without sufficient rest, the ligaments and tendons may tear away from the bone, or parts of the bone can separate from each other. The same goes for Little League shoulder. During an overhead pitch or throw, an athlete's arm moves through several extreme positions that may put the upper arm under a great deal of pressure. Over time, the repeated stress of throwing can cause the growth plate at the top of the upper arm to become injured and inflamed. On an X-ray, the growth plate has the appearance of growing wider. If the athlete continues throwing, a type of stress fracture may develop in the growth plate itself. The research article that I have selected to talk about goes into detail on how if a prevention program for youth players at higher risk for elbow injuries could positively be affected by a prevention program to lower the risk of medial elbow injury in youth athletes. The hypothesis for the study was that the program would be effective in reducing the incidence of medial elbow injury by 50% compared with a control group who maintained their usual training. This experiment lasted a total of 12 months. For this experiment, two groups of baseball players between the ages 8 and 11 were created. The first group, the control group, was composed of 169 players. These players were instructed to continue their usual training over the study period. The second group, the intervention group, was composed of 136 players. These players were instructed to perform the throwing intervention program during their warm-up at least once per week. The throwing prevention program consisted of 9 stretching and 9 strengthening exercises designed to improve parameters of physical function identified as risk factors for throwing injuries in previous studies. The following outcomes were also measured within the experiment: clinical assessment of the elbow and shoulder joint, ultrasonography assessment of the elbow, and assessment of physical function including passive range of motion of the elbow, shoulder, and hip, strength of the shoulder and scapular muscles. Each assessment was collected at the 3-month mark and the 1-year mark of the experiment. Each assessment was performed by the same examiner who was blinded to the group's assignments. Following the 12-month experiment, the incident rate of medial elbow injury was significantly lower in the intervention group. The program improved total range of shoulder rotation, hip rotation, shoulder internal rotation, lower trapezius muscle, and thoracic kyphosis angles. Improvements in the following variables of physical function were predictive of a lower rate of medial elbow injury: the increased total shoulder rotation, increased hip internal rotation, and the decreased thoracic kyphosis angle. There are 2 limitations to this experiment that worry me. The first includes that the 2 groups were not randomized. Each group was purposely selected and designated an assignment. The second includes that the 2 groups were not blinded from their assignments. These limitations could bring about extra strength and mobility exercises performed not allocated or selected by the experimenters, and the outreach of extra physical therapy and medical assistance, and more. In conclusion, I believe that this was an informational and well-constructed experiment. I believe the prevention program implemented to the youth players is excellent. The 9 stretching and 9 strengthening exercises within the group are all great. Even as a player, I've always believed in prevention programs such as the one I talked about today. I'm a big believer in dynamic warm-ups, mobility warm-ups, range of motion warm-ups, and so much more. I've never been a believer in just participating within the sport of baseball cold or with no warm-up whatsoever. As a coach, I would highly recommend and incorporate programs like this with my athletes. This not only puts my players in the best position to reduce injury, but it may provide better sport performance and longevity of health within my athletes' playing time. Thank you.